At Signature Healthcare, we have built a seamless total joint program where we're integrated with the primary care physicians. They assess their patients and decide who needs to see us in referral. We're able to get the primary care's record and read that and review their previous x-rays on arrival, then assess the patient ourselves and set up a surgical date. Once that's assigned, we write back through the electronic medical record to the primary care physicians. They know when we're going to do the surgery, the type of approach that we're going to do, and then they will answer specific questions we have about certain medications that may need to be modified prior to the surgery, whether the patient needs additional testing prior to a surgery, and so we're able to get all of that done. Once the surgery is done, we send them a complete report on what we did and what our therapy and medication plans entail.